Have you ever been curious if your posture affects your ability to run, or how well you can run, how fast you can run? Or maybe you've been curious if your posture is causing some form of joint pain. These are some of the things that I want to answer in this video. My name is Dr. Molly, and I'm with Your Goals Physical Therapy. This is National Posture Month. So I am super excited, and I thought I would do an entire series on how posture can affect different sports. So in this video, what I'm going to do is I'm going to talk about what posture is, how it directly relates to each individual sport. So this week I'm going to talk about how posture affects running, and then some common injury, just to see if you're on the right path, like if you're dealing with something yourself and maybe you have questions about what's going on with you. I'm going to give 2 examples of things that can be tied into your posture, running injuries that can be tied into your posture. And then what you do about that, because why talk about it unless we can come up with a problem or a solution to the problem? So those are the things that we're going to talk about in this video. Let's start by defining posture. So really at its crux, at least how I use it, posture is how you hold yourself up. Another way to say that would be, how stable is your spine and how is your spine aligned? So in some people, you've seen them where they're kind of hunched over. So their posture is rounded shoulders, their head's forward. Some people's posture, they have their upper back is actually kind of behind their lower back. So we would call that a sway back. So that is different postures, or those are different postures. And there can be good and bad, and there can be reasons why that works for some people and not for other people. But when you're talking about for your sport, just your passive posture isn't as important as your posture while you're moving. So what do I mean by that? How stable can you keep your spine while you're moving against random forces? So in this video, we're going to talk about specifically running. So in an ideal world, our spine has 3 little curves, and they're not as dramatic as what we perceive in our head. Our spine is relatively straight. There are some minor curves that help us absorb impact that are kind of ideal, right? But everybody ages with their own flavor, so some people's ideal is not the same as other people's ideal. So in my world, we just start with a general idea of where it should be, and then we piece together what's actually happening with somebody and if that's really causing a problem. But when you're running, what you need your posture to do is to stay stable. So you want your trunk from your shoulders to your hips to stay stable against a lot of different forces. For instance, your arms are going to be swinging, so you have a little bit of rotation. If something in your, like your cervical spine, so your neck, or your thoracic spine, so where your ribs are, is not very stable or not able to withstand that, then what happens is slowly you get this rounding, or you get something that tilts one way to the other. So while you're running, that can cause a whole host of problems. But you may not notice it while you're standing. You may be perfectly fine while you're standing, and it doesn't appear until you get that arm swing going and that compression that happens when you're running. The other big thing that we're looking for when you're running is to be able to keep your lower back stable while you're moving your legs up and down. So you end up on one foot and then you end up on the other. So if you're going back and forth this much, think about how much energy you're expending just going side to side, let alone the up and down that happens from the bounce. So it's a lot of energy that's being left on the table, so to speak, because you're just expending it. And so if you're trying to improve speed, if you're trying to improve how far you can go, being able to conserve that energy definitely helps. And that is one way that your posture and how you hold yourself, how basically stable you can make your spine while you're moving, and why that's important. And so, especially for running. Because not only do you have to contend with just your own body, just me moving my arms, just me moving my legs, I have to contend with all the compression forces. So I'm going to hit the ground, which means that I have to absorb impact from my ankle up to my pelvis and into my lower back. So if my spine's not stable, something is going to move. Right? And it's just a matter of where, because and then that brings me to the next part of this. So what are common injuries? Just because your spine's not super stable, I mean, whatever, it's not bothering me while I sit, it doesn't bother me while I'm at work, so why is it really a big deal when I'm running? So as I was talking about, being able to absorb all of that movement and combat all of that movement is important for running, because you're trying to generate energy and you're switching things. So you're going side to side, your arms are pumping. If your upper back and your neck are not strong, then as you're moving your arms, your shoulders are going to become more rounded, which is going to stretch out all your back muscles. Your head's going to come forward, which is going to add even more stress to those back muscles. And so then over time, so maybe not the first 5 minutes of your run, but 10, 15 minutes, 30 minutes into your run, you're going to notice you have either upper back pain or shoulder pain just from the weight and the impact of the weight of your shoulders, and your head, or the impact of it hitting the ground. All of that's going to make this collapse forward, because if your spine's not stable and stiff, it's not able to keep you upright against all of those forces. So that becomes a problem, especially as you're running. And if you're collapsing this way, think about what that does to your lungs. Now you can't even expand your lungs anymore because you're kind of folded in on yourself, which isn't good. Being in this position is pinching your rotator cuff. And that's one reason why many people end up with shoulder pain while they're running. It's just from that collapse of that posture. You're just sort of pulling in and everything is just sitting bone on top of bone and just resting there, instead of being able to hold itself up and be nice and tall, keep all that joint space nice and active. So that would be a shoulder injury. So big common things is having that back shoulder pain or even front shoulder pain, and it's just from that collapsing in on that posture. Now, if we talk about a lower, like a leg injury or something that's going on with that, is if you can't keep your lower spine and your pelvis stable, then your hip isn't stable. And the way that I would equate that is, if I was going to build a house, I wouldn't want to put it on silly putty or sand. I would want to put it on cement or a hard surface, because that way all the walls would be stable. It's the same thing that happens with our hips. If our hips are not, or our pelvis is not stable, then our hip doesn't have a good leverage point to pull from. And that means that the muscles in my legs have to work harder to be less efficient, which isn't a really good system, right? So if my lower spine, specifically like lumbar spine, is not stable, then my hip flexor has to do more work to pull my knee up so that I can run. Over time, that extra work leans into tendinitis, which is why many runners have hip flexor pain. And it stems from not being able to keep their trunk stable while they're pulling. And so that's what that is another reason why making sure that your posture is really good just statically, so just while you're moving around in your everyday life, and then that way you can progress it while you're training to run. Now, let's say, you know what? I've been told for years that I have bad posture, and I have done so many things to try to figure out how to make that happen. I have stretched, I have strengthened things, I have gone to chiropractors, I've gone to massage therapists, I have done it all, and this is how I am. I would say, honestly, for some people that is entirely true. Some people just have a different way that they were built and it ends up working for them. And so if you're not having any problems or any pain, then I would say, don't worry about it. If you're able to run at the level that you want, you're not dealing with injuries, having a perfect spinal alignment isn't really important. But if you're finding that you're slowing down your speed, that you're having shoulder problems, that your hips aren't working exactly the way that you want, like you're getting a little achy pain, getting IT band issues, then I would say adding certainly abdominal strengthening, upper back strengthening. And I think that's the big thing that most people forget. When they're trying to make their overall spine more stable, we automatically think of abs and maybe we think of butt, but we very rarely think of upper back. And that ends up being a big issue for a lot of people because they don't think about how you pull your shoulder blades back and how you stabilize your upper body, which does affect the rest of your spine, especially when you're talking about dynamic movements, because if you can't keep this from happening, then your lower back's going to curl also because it's all connected. And so that is like the number one suggestion. So what do you do if you think that your posture is causing you problems? You want to strengthen your upper back. You want to strengthen your stomach muscles. You want to strengthen your hips. Then you want to make sure everything is flexible. You want to be able to have full range of motion in your shoulders. You want to work on full range of motion in your hips. And you want to be able to keep your trunk, so from your shoulders to your hip, stable while you're doing your run. And so some of that's just practice, just keeping things upright. And some of that is just overall strengthening programs. Now, if you've been trying to deal with this and you've been going through step by step and you have a really good ab strengthening program, you do really good flexibility and you're just still so frustrated, those are the things that I help people fix all the time. Because it's normally like one small thing that somebody needs to adjust or correct for, and then it opens up a whole world. It is really hard to identify a specific joint that's locked out on yourself. And so having somebody who can watch you run, somebody who can actually assess all the different muscle lengths and assess strength and a variety of different things, watch you do dynamic movements, help you isolate certain things, certain motions and certain muscle groups to see how they're doing compared to their counterpart. All of that it's very hard to do that to yourself. Even, we all have to ask for help for a lot of those things. Because it's very hard to do that to yourself. And so having somebody that can explain what's normal, what's not normal, what's moving well, what's not moving well, and how you progress out of that, that's what I help people do all day long. That is actually a huge joy. I just absolutely love helping people get back to running the way that they want to and help them problem solve the one thing. Because our bodies are amazing, and a lot of times we just have to know how to allow them to heal, and so that we kind of get out of their way, right? We get out of our own body's way and allow it to heal so that we can perform at the levels that we want. Because running and being active is just the best part of everything. It helps you with friends, it helps you with just your mind and keeping everything healthy, your emotional context, all these things. It's so wonderful to be able to have a sport. And so if you are struggling with something that you think is related to your posture, I'm going to leave a link below that you can use to call or to set up an appointment just to see if I could even help. Not even a full appointment. Let's just chat and find out if I'm the right person to help you solve the problem that you're having. Until then, I hope you're having a fabulous day, and I will talk to you.